Okay, I thought I'd just give you a little brief background about the United Health Group because as being a new myself, people, the first thing they remember is the insurance company United Healthcare, but United Health Group has two distinct businesses, the benefit business as well as health services business. So I'll just touch very briefly about who United Health Group is. Then I want to talk a little bit about initiatives we are taking as to modernizing healthcare delivery, which is member-centric and continuum of care solution, give you a couple of examples. And then I will, to finish up, just talking about two examples of large-scale enabler for, which will be very important for as we move towards one way or other accountable care type of delivery system. So as far as United Health Group, it's a Fortune 25 health and well-being company. And our businesses are grouped under two. On the left, you're seeing health benefit. On the right side is the health services side. So on a health benefit, and also on the top, these are the three commonly brands we use: United Healthcare, AmeriChoice, that's for the Medicaid state base, and then Ovation is for 55 and older Medicare as well as retirement. So we insure for commercial, individual, Medicare, Medicaid, also military and tri-services. On the health services side, on the bottom, you're seeing three major brands. Ingenix is the company that is in healthcare informatics, analytics, and professional services. We do have a prescription services, PBM operation, and also Optum Health, which provides the behavioral health as well as wellness and prevention and acute care. So most of our healthcare delivery is under Optum Health businesses. And so basically what we as a company do is what you're looking at through our Ingenix division. What you're seeing is that we have covered life is about 75 million, or 1 in 5 American is one way or other is insured for us. We do both risk-based insurance as well as administration for large commercial employers. So we have individual and employer or seniors and government and commercial, all the lives covered. So we have information on their eligibility, claims, costs, clinical, all that is being collected as part of running the insurance operation. What we do then, use this information to almost nearly real time be able to take this information through the claims or the reference data or prescription fill or the lab result, and we are able to keep this on a personal health record level. And we have 3 years data online, so instantly available, and then archived for 7 years in our data warehouse. So we are able to add this information about the members in terms of their customers' behavior, provider, what different doctors or hospitals we're going. We have contract with 650,000 physicians, 5,000 hospital. A lot of them we are just interacting that they are seeing our insured member and we are doing financial transaction. But in this information age, we are able to take the information down to individual insured member, not just the eligible family member. And we are keeping track of what is happening and be able to take this and apply that against the standard-based predictive modeling and trying to provide a useful information as for the healthcare encounter. So our focus is we are interested in modernizing the delivery of systems to solve key problem, but today healthcare is very fragmented. I even put a little refrigerator on the wheel, just a meal on the wheels, and hospitals, the home, and different places. So we believe in order to solve this, the solution must be focused on the individual, we call members. And so what we have done is we have kind of grouped into 3 areas. First is we want to help people to stay healthy. So we have a series of project services that are allowing community and population based on the prevention, wellness side. Then next group is get healthy. Those who do get sick, we want to have help them to get healthy and be done with. And then who have chronic disease, we want to help them live with the illness and still get the productive life. So we are looking at the value is basically optimum clinical outcomes and health status time the efficient use of the resources. So we're looking at the continuum, the whole picture. We provide a lot of communication. Our focus is a lot more on the member-centric. As I mentioned, we have over 75 million people insured, and we communicate to them. There's a personalized portal to every single insured. They can go to myusc.com and others. They can get the personalized information, but not everybody has access or want to see the portal. So some are higher in the food chain of IT readiness, so we have apps on the iPhone or BlackBerry smartphones. Some just want paper. So we do a lot of direct mail information about the benefits, and then you got personal health coach and also the different kiosks. So our way of telemedicine is really connecting care, and so we have, and again, it's focused on a member at a given time. They will have different needs in different places. So it's not centered only one hospital or only one doctor. It's centered around the person who may need. Sometimes they need while they are in the office. Sometimes they're traveling. Sometimes whatever it is. So our focus is on the member. So we have a service, we call it Now Clinic, and basically it's 24/7. If the members signed up, they can get access to a healthcare provider. We also have the telemedicine aspect of primary care, rural clinics, worksite setting clinics, as well as complete health and support. So in terms of the telemedicine network, we feel that we have all the right tools, and those we're lacking, we find partners. So we have the patients, we have the networks, we have the analytical data, and the technology relationships. We're partnering with the partners and the software to provide the sustainable telemedicine. But we keep coming back to to have a scale and sustainable. We have to look at the value proposition throughout the key stakeholders. The patient have to believe in this. The new way we're trying to change the healthcare delivery is good for them, because today, if you are insured, you feel entitled that if your copayment is $25, that's all you're going to do it. Don't tell me that this is better unless I'm convinced. And a lot of people do not pay enough attention onto this part. We think it's very important, and we think we have ability to communicate, because we do communicate to the members, and we can influence on that part.